thank Dr. Carlos Del Rio for his extraordinary leadership over this last very difficult year, and the entire team that showed such hospitality to me this morning and really helped me to better understand what a gem this institution is for the city of Atlanta and the state of Georgia. Grady Hospital has a team of more than 7,000 who are working diligently, taking personal risks to provide vital healthcare services to the community. Grady has shown leadership that's been nationally recognized as we have all adapted to the historic challenge of this COVID-19 pandemic. I just want to again salute all of the healthcare workers, the nurses, the doctors, the techs, the staff, the clerk, everybody involved in the effort here who have saving lives every day and have saved lives throughout this pandemic. This is also a visit that's personally meaningful to me. My wife, Dr. Alicia Kramer, does significant work in the OBGYN unit and in labor and delivery here at Grady, and always speaks so highly of her colleagues here. I want to provide you with just a quick update on this COVID relief legislation that's moving now through Congress. The Biden administration released in January their American Rescue Plan proposal, which is focused on two core objectives. One is defeating the pandemic with a particular focus on the immunization campaign and supporting our healthcare infrastructure. And second is getting direct economic relief to the American people. About 2 weeks ago, the Senate passed the budget for this COVID relief plan. Right now, the U.S. House of Representatives is moving forward with a bill. Once the U.S. House of Representatives passes that bill, it will come to the Senate. I am urging my colleagues in the Senate to move swiftly to pass this legislation, which will include resources, for example, to expand America's healthcare workforce by 100,000 people, which will include funds for community health centers, rural and underserved areas that need clinics and additional healthcare support during this pandemic, and will include significant direct economic relief for the people of this state. The bill in its current form would deliver to an average working class family of 4 here in Georgia $8,200 in direct economic relief. And I have been working alongside my colleague, Senator Reverend Warnock, to make sure that all of our colleagues in the Senate understand how vital it is that the people get the relief that they need. Finally, just want to add a couple of priorities that Senator Warnock and I have been working on together to advance in this legislation. One is additional federal resources to incentivize the state of Georgia to expand Medicaid. Medicaid expansion will help more Georgia families afford health care. It will also help sustain hospitals like this one and healthcare providers across the state of Georgia. And getting that Medicaid expansion incentive into the legislation is a top priority. So thank you again to the team here at Grady. Thank you to your amazing staff. Thank you to the healthcare workers. And I look forward to working with you to ensure that this facility is well supported and that your teams have everything they need. There's going to be significant resources for PPE, significant resources for immunization coming in this legislation. And as I conveyed to you when we met earlier today, I'm at your fingertips. I'm here to serve. I'm here to serve the people of Georgia. Any questions? And Jake will call on you.
Senator, one of the hang-ups in this bill might be push to raise $250. If that can't be achieved in this bill, is that a deal breaker? Is that something that must be
I'm going to continue to support the increase in the minimum wage to $15 and working with colleagues in the Senate to try to ensure that's included in the legislation. This is why it's so vital that Congress pass this legislation swiftly, and why I'm urging my colleagues in Washington to move quickly to pass this bill, because there is a challenge in increasing vaccine supply. And this legislation will include significant investment in making more vaccine available to the American people so that by midsummer, if not before, there are enough doses to get everybody immunized.
All right, we're going to go to Sam. Senator, so you talked about Medicaid expansion. There's obviously this sweetener for states like Georgia to finally expand Medicaid and the American Rescue Plan. But Republicans in the state have resisted doing that for years and years and years. Now the Biden administration has shut down Georgia's Medicaid expansion plan. So what makes you think that this added sweetener in the American Rescue Plan is enough to get states like Georgia to come along with full expansion?
Look, it will be the moral obligation of political leadership at the state level to take the step necessary to expand Medicaid. And what Senator Warnock and I are working to do is to give Georgia a do-over at this, so that they will be able to benefit from even better incentives than they would have gotten had the state of Georgia expanded Medicaid when the Affordable Care Act was first passed. This has to be a collaborative, bipartisan effort with Republican leaders in the state of Georgia, and Senator Warnock and I are working to ensure that these incentives are included in this bill to make it an even better deal for Georgia state government.
Well, and are you worried that the Biden administration's present pause on Georgia's Medicaid expansion is going to make Republicans dig in their heels?
I'm not, and I think that if we can get these additional incentives for Medicaid expansion into the bill, then the state government will have a moral obligation to move forward with Medicaid expansion.
Yes, what is your office doing to help speed up the additional stimulus payment for people who are sitting on pins and needles waiting for them, not just for families of poor, but the individuals, and what are some of the challenges you all are facing?
So the Senate approved the budget for COVID relief to include the stimulus checks and tax credits for working families about 2 weeks ago. The U.S. House is now moving to pass the COVID relief legislation in the next 2 weeks, and it will then come to the U.S. Senate to pass that bill and send it to the president for his signature. And what I am doing is urging all possible speed for the passage of this legislation, because Georgia families cannot wait for this financial relief. Georgia families are facing eviction and foreclosure. Georgia families have credit cards maxed out, have bills piling up, extraordinary child care costs as so many school systems remain closed, and that's why it is urgent that the U.S. Congress act to pass this legislation and get that direct relief to the people. So I'm urging speed, and Reverend Warnock and I have also been urging that there not be cuts to this direct economic relief. And as I mentioned, the bill in its current form would deliver to an average working class family of four here in Georgia $8,200 of direct economic relief between the stimulus checks and the tax credits. Thank you.
Was there anything on the tour that was particularly eye-opening to you? I don't know if this is the first time you stepped into a hospital like Grady, you've been at the emergency clinic. Was there anything that really stood out to you during that tour?
Well, Dr. Hani Atala showed me through the emergency department, the world-renowned trauma center that Grady Hospital has, and I really gained some insight into the adaptations that Grady has made so swiftly and smoothly to continue to provide the service that the community depends upon, while also adapting to the needs of this COVID-19 pandemic and preventing the transmission of disease within the hospital. Thank you.